In disability population, 47.5% are learning disabilities. Myself Sumar, I am the student of occupational therapy. Approximately all individuals with learning disability are having problem in the area of reading, so they can't able to read. IDEA gives definition for specific learning disability. What is IDEA? Individuals with Disability Education Act gives definition for the specific learning disability. So IDEA defined as it is a disorder in basic physiological process. That process involves in understanding or using the language, or the process involved in spoken or written, and also listen, think, speak, read, write, spell, doing mathematical calculations. And the term does not include the disability due to visual, hearing, or motor retardation, and mental retardation, emotional disturbance, cultural disturbance, environmental disturbance. So these are all not included. So the physiological process only involved in the reading, writing, spelling, so that like mathematical academics area only. So simply we can remember learning disability is nothing but the child has a intellectual ability but they can't able to learn. So there is a discrepancy between the achievement and the intellectual ability. Their intellectual ability is high but their achievement is poor. So in which abilities? Oral expression, listening comprehension. So in that area, expression. So in these abilities or intellectual ability the child have, but the child can't achieve this. Then this is the learning disability is caused due to many reasons. So in all reasons there is an involvement of CNS, central nervous system is involved. May due to the heredity. Learning disability may run in family or due to the factors of during pregnancy. The mother may face problems during pregnancy or during childbirth. So these problems can cause a learning disability to the child. So the mother may use alcohol or drugs during pregnancy. Lack of oxygen, low birth weight may also leads to the learning disability. Some incident after birth also cause the learning disability. Head injury to the child, nutritional deprivation, some nutrition or deprived to the child, or some poisonous exposures, example lead. So that like poisonous substance are exposed to the child. So these also leads to the learning disability. Even child abuse after birth, child abuse can also attribute to the learning disability. Okay, what are all the characteristics of learning disability? In learning disability child, some problems are there. So in DSM we are discussed what are all the symptoms. So same symptoms can apply to the characteristics. They have problem in reading comprehension. They can't understand what they read. Writing, reasoning ability, difficulty in writing, difficulty in reasoning ability, hyperactivity, perceptual coordination problem, difficulty in correspondence of sound or symbol, difficulty interpreting, so understanding the body language, facial expression of others, or tone of voice. So they are speaking with angry or something, so they can't able to differentiate the tone of voice. It's mild or severe, so that like they have difficulty. So they having some memory problems, they don't remember some things, some coordination problems, holding a pencil, so it may be inconsistent and slow or messy, and walking, so gross motor walking and fine motor, tying a shoelace. So these areas are all affected in the learning disability. Okay, we'll discuss some common types of the learning disabilities. First, dyslexia, difficulty in reading. They having trouble in understanding the words, letters, paragraph, or a sentence. So preschoolers may show some symptoms like they have problems with pronunciation, problem with rhyming words. They can't able to learn rhymes. So preschoolers are all showing these symptoms. Preschoolers may can't able to learn the shape, sizes, colors, and they can't write their own name also. So difficulty in telling the story. So once we tell the story, they can't able to retell the same story as a scholarly manner. If the child is in primary school, they may have a difficulty in reading a single word and confuses with the DB, so that like confusions, and they may reverse the word with as a tip, so they may confuse intellectual ability, but they express themselves below that level. If the child is high school, then they have a poor reading, word spelling, and they can't able to write, and they have a problem in understanding the foreign language. Type 2, Dyscalculia, difficulty in mathematical calculation. So they lack the number knowledge and mathematical reasoning. They may made some common mistakes, like when writing one, they add another one, 11 they write. So addition and substitution. Instead of 1, they write 4. So substitution, transposition, 41 as 14. So that like 1 4 4 1. So that like transposition and omission. 41 4 only, right? They omit the 1. So that like omission and reversals. So 41 as 14. So these like common mistakes are made in child. So they have a mathematical problems, means they going to face the money problem. They can't able to calculate how many money they have, how many money how to give to the shop. So they affect socially. They have the inability to grasp and remember the maths concept, rules, formulas, that all. Having problem in long term memory. So these problems are having in dyscalculia. Then dysgraphia, difficulty in writing. They may write unfinished words, omitted words. So in one word they may miss some letters. So they use uppercase, lowercase, A, B, uppercase C. So that like, so they have mixture in nature. And during writing they have a irregular size of letters and inconsistent position on page, which means they write in a same line and they write in a this like line. So inconsistent position on page. Then dysorthographia, in which they lack the symbol knowledge. Addition, so plus minus multiplication of the symbols. So they can't understand the symbols and they don't write these. So not only symbols, they have a lack in spelling. So yes, so that like spelling also they have a lack. Okay, these are all the types of the LD. Okay, LD is most common in males than females. So males are more affected than comorbidity of the LD. So LD is always associated with this disease. What disease? ADHD. So LD may be occur with ADHD. So LD may be confused with these conditions: mental retardation, autism, deafness, blindness, and behavioral disorder. So these conditions are may confuse the learning disability. Did you know most of the parents noticed the learning problems, but they waited for a year and the child converted into the severe stage. So skipping is might be the serious problem. So think and try to prevent the learning disability. Be positive. Thanks for watching. Bye bye.